This video shows you how to apply mirror therapy for low back pain. In this case, we are trying to retrain lateral flexion. Since the ball is round, it helps the patient with the movement. The markings on the patient's back are an additional visual aid, so he can better see when he's moving his back in the right way. If you watch his upper body, his shoulders closely, you can see that trying to move his lower back is a real struggle for him. Motor control in all kinds of chronic pain patients, and especially in back pain patients, is severely impaired. You can start out moving the non-affected side so that you get a visual impression and the feeling of how it feels when that side is moving, and then try to do the movement with the affected side. If you don't have a mirror wall like we do in our clinic, you can also use two smaller mirrors. Just make sure that you can see both sides of your lumbar spine. Once you have re-established good motor control, meaning that you can do the movement smoothly, we do the same thing in a standing position on an unstable surface. In this position you can lock the knees and push the heels into the surface on the left and the right side. Again, watch what happens to the upper torso and the shoulders. The patient should be able to initiate the movement from the lower back. I like to use lateral flexion with my patients because that's the movement the spine is making all throughout the day. The thinking behind this is that if you manage to establish motor control over lateral flexion, then every step you take during the day is another repetition. In this way, it's a very practical and functional approach because it mimics what the spine is supposed to do anyway. You could also combine this with other types of treatment like sensory discrimination training, two-point discrimination training, and so on. The only problem with that is if you yourself were to do it, you already know if you are touching your back with 1 point or 2 points, so it's not very effective. My focus here is to show the patient how he can do this at home and which movement he should go for. This gives me the opportunity to focus on, as I said, sensory discrimination training, which he can't do himself. As for how long to do this kind of training, I would say it takes at least between 5 minutes for the first effects to show, so that the movement becomes more smoothly, and anything up to 30 minutes. After that, most clients are very tired. So give it a try, and if there are any questions, let me know in the comments below.